Welcome to the office.
Welcome back.
Thank you.
How you doing?
Doing great.
Okay, so what happened from yesterday?
So from yesterday, just did a lot of walking around,
Okay.
and just feels better in my legs. Neck felt better. Had a little trouble sleeping, but I was like conscious of the
jaw?
yeah. So I think I did a little bit better last night. So hopefully.
All right, how'd
Keep
the
it
hip
going.
do? And the hip did okay?
Hip's doing good. Yeah, it doesn't feel stuck anymore. Feels like the full range of motion
Okay.
from before.
Right on, dude.
And it's weird because it's like the right hip was the adjustment, but it felt it in the left hip. I guess because they're connected.
Again, another great lesson for everybody. And what's the lesson? In the work, what Dr. Gonstead found is when you're looking at the pelvis, and there is one exception, and it is rare. And usually the way the pelvis works, they work in opposite, okay? One goes up, the other goes down. One goes in, the other goes out. So they work in opposite. One usually gets stuck or subluxated. The other one usually compensates. And so many times what happens is the stuck one isn't the one that hurts because we've been compensating on the opposite side for so long. There is an exception, and the exception is, I've probably had 3 cases in 20 years. And where both are truly subluxated, both are truly stuck. And it's called an INEX or an EXIN, where one goes EX in, the other one goes IN. But rarely will you find both of them misaligned subluxated. You can find one stuck, one compensated. Long-standing compensation can become a subluxation, but it's rare. So a lot of times patients will come complaining just as you did, my left hip hurts, and I find it that it's the right. My right hip hurts, it's the left. My left shoulder hurts, it's the spine. Okay, my knee hurts, it's the hip. My ankle hurts, it's the sacrum. Anything can cause anything.
I see.
Cool, right?
Yeah.
Okay. You ready to get started?
Yes, I am.
All right, let's do this, dude. Relax the shoulders, please. Good. Starting at the base of the neck. Let's see what we got today. I'm getting heat up here, but I'm not getting a break. So we will see. Let's see, maybe the meter's cold. Let's run it a few times. We're gonna wait on that. We'll see what happens after the rest, okay? So today I am getting a tiny bit in, nope, again that's compensation too. It looks like it's going to break, it goes to the right. Sit up straight, let's try that again. And let's show everyone how posture can actually affect the scope readings. Nope, it's not there. Did it? Got a tiny bit there. Around T5, T6. That's a break. You got to make sure a patient is dry. Cool, man.
So the break means it's not a real. It's like a faux reading.
The break is the reading. If it just sticks to one side, that's usually just heat. We're looking for the break, for the pointer or the needle to go to one side and come back. We have not really. We're going to check the pelvis again, and I'm getting T6 area. That's it, dude. And then we'll check the neck afterwards, okay?
Okay.
Let's feel what's going on over here. So, static palpation. The break is at the level of the nerve, But the spinous of this is going to be down here. That's why it's more tender here. And let me demonstrate that. Another cool lesson. If we're looking here, you can see that the spinuses, they're called imbricated. They're imbricated spinuses. They go down. They're shorter here in the cervical spine. They're shorter in the lumbar spine. But they angle down in the mid-thoracics. And so the nerve is here, let's say. Where'd my nerve go? There it is. So let's say the hot nerve is there. But the contact point is going to be where? It's going to be down here. Sorry, right there. So it's going to be below where you get the break. Let's do that again. 1, 2, 3, 4, 5, 6. 6 is tender, yes?
Yeah.
So 6 is there, the nerve of 6 is up here. Okay. Let's check that hip. Feet together, open and close the knees, open and close. Left side only. Yeah, we still got to do this right hip. Right side only. Cool. Let's walk it off once and let's get started. I have one video where it was a true INEX, double subluxated pelvis. And I did it, we do it in one adjustment. You can do it in two, or there's a really cool way to do it in one where you set both pelvis, both sides in one adjustment. Maybe I'll put the link in the description for these guys.
That'd be cool, yeah.
Let's lock it out. I'm going to work on your right ankle today also, but we know the ankle is coming from the hip. Okay? But I will work on that too. Walk one more time, please. All right, let's go right side down.
Right side down.
Let's do that ASIN. So I'm on the, look straight ahead please. So if I bring the knee up, it opens it up a little bit. It's right there. We want to bring it down and out. Torque out. Okay, let's see what we got. And that's the home run. Nice. Wow. Stand up, walk it off, please. Very nice. How you doing?
Good. That was powerful. Feel myself like go forward on that one.
Okay. What do you mean go forward?
Just like roll forward on the bench, you know.
I rolled you a little bit more.
Oh yeah.
Just to get a little deeper set today.
Good.
Okay, let's go high-low over here, face down. All right, 12, 11, 10, 9, 8, 7, 6. Now what's interesting, this is a PL-T.
Dash T?
Means it's the opposite contact. So it's PL, the spinous has gone to the left, but because it's in a concavity, we're going to be on the opposite transverse for the adjustment. Shoulders down, please. 1, 2, 3, 4, 5, 6. That's the transverse there. Get the tissue out of the way. Get this piezoform on there. There you go. Nice. Oh, spicy today.
Yeah.
1, 2, 3. I'm going to come over, get the tissue out of the way, push with the right hand transverse, forward. There's the rest. Nice. How's your breathing been?
Good.
Been practicing your breath work?
I've been practicing the diaphragm. You said breathe in, diaphragm out,
Yes.
belly button out.
And it's been helping?
Yeah, I feel like it's kind of strengthening down there. Because I feel like I would breathe in, but then it would just kind of stop, and I would just keep going. But like take a new breath, you know.
Mm-hmm.
So I think that is helping. That's
Walk it
good.
off this. Have a seat. That actually helped your ankle day adjustment. Head down.
That might have been like the biggest one for me.
What's that?
That's the second one, that just now.
The T6?
Yeah.
Really?
I don't know, cause like you kind of moved it a little bit before.
Oh, you mean the second time I went after it?
Yeah. I think
There was a lot more to it, yeah.
Yeah, you were moving the tissue, and then it just like started cracking a little bit, and then you did it, and I was like, oh.
Let's see what we got.
I remember that first T7 one. That was a good one too.
We got heat. Sit up straight.
Yeah.
So I'm tilting the scope. Nada. Alright, let's check the jaw. Slowly open. Open, open, open. Right side, left side. We're going to do the left side first and then the right, okay? Open all the way. Close halfway. And I'm just applying the lateral to medial pressure on the left side. Okay, let's use the condyle for the next one. The purpose of the condyle block that Dr. Gonstead came up with was to stabilize the cervical spine when you're doing the TMJ adjustment. You can also use it for an AS occiput prone. Sorry, AS occiput supine. Open, open, open. It's already a little different. Close. Open. Open. Slowly close. There it is. Come on. You got it. There you go. Nice. Sit up straight. We're using I call it the buff and polish. This is basically vibration therapy. This is not percussion. It's not doing this. It's not doing this. It's doing this. And it's a little different than those percussion devices. Raise your right leg. Relax it down. AS talus, medial tilt. Same thing. Okay, walk it off last time.
Alright.
So you got some homework. You're going to continue your walking. You're going to continue the walks. You can do ice massage to your TMJ with an ice cube.
Ice cube.
Ice cube massage it.
Right up here?
Right there, right on that condyle. I would do it once a day, both sides.
Gotcha.
Okay, keep walking. Your diaphragm breathing is important. And I think I'm going to do a video for everyone on breathing exercises. Okay? There's about 4 or 5 different breathing exercises I want to go over with people. Keep walking. One more time. One more time.
Those.
Yeah. I think I'll do one this weekend.
Awesome.
Squeeze my hand. Squeeze. Tiny bit on the lunate. Squeeze. Squeeze. Scaphoid. Doesn't want to go. Almost. Let it go. Let it go. Squeeze. Good. Steven, you're all set on this trip. As I said, focus on your sleeping positions, your walking, your icing, your breathing exercises, and have fun.
Alright, sounds
All right.
good. Thanks, Dr. Rahim.
You're welcome, sir. You take care. Safe travels back. Wait at least an hour. Get walking in before you drive off.
For sure.
All right?